Today I'm going to talk to you about osteoporosis. The word osteoporosis itself means porous bone, and with good reason. Osteoporosis is a bone disease characterized by low bone mass and structural deterioration of bone tissue. This leads to bone fragility and an increased risk for fractures, specifically fractures in the wrist, spine, and pelvis. Osteoporosis is the world's most prevalent bone disease. Over 1.5 million osteoporotic fractures occur each year. Over 10 million Americans are currently living with osteoporosis. Additionally, 33.6 million people are living with osteopenia, which is the precursor to osteoporosis. It is estimated that 1 out of every 3 Caucasian women and 1 out of every 5 men will suffer from fractures related to osteoporosis at some point in their life. Bones develop and strengthen as we age, from birth until young adulthood, with peak bone density occurring between the ages of 18 and 25. As a person grows and ages, their bones continuously change as well through a process called remodeling. Osteoporosis occurs when normal bone turnover is altered. This happens when the rate of bone resorption by osteoclasts far exceeds that of bone formation done by osteoblasts. This causes bones to become increasingly brittle, fragile, and porous. This also in turn causes them to fracture easier under conditions in which bones do not typically fracture. Fractures are the first clinical manifestation of the disease. Spinal and hip fractures are particularly concerning. Spinal fractures can result in serious consequences, including loss of height, intense pain, deformity, and hip fractures often require surgery and may subsequently cause loss of independence and even death. When it comes to risk factors for osteoporosis, some things can be changed and some things cannot. Things that people cannot change are their gender. Females are more likely to develop osteoporosis after menopause. Age. You cannot change your age, and it is more likely that your bones are going to become thinner and weaker as you age. Smaller, thinner boned people are more at risk for developing osteoporosis as well. And when it comes to ethnicity, Caucasian and Asian women are more likely than African American and Hispanic women to develop osteoporosis. A family history is also a risk factor. People whose parents have had a history of fractures are also more likely to have reduced bone mass and may have fractures themselves. Some things that can be changed are calcium and vitamin D intake. A lifetime diet low in calcium and vitamin D makes a person more prone to bone loss. Medication use. Long-term use of certain medications such as corticosteroids and some anticonvulsants can increase the risk of developing bone loss and fractures. Lifestyle is also something that you can change. An inactive lifestyle with a lack of exercise can increase your risk for developing osteoporosis, as can cigarette smoking and alcohol use, especially excessive alcohol use, which is 3 or more drinks per day. There are also many diseases that can increase a person's risk for getting osteoporosis. These diseases include type 1 diabetes, untreated long-standing hyperthyroidism, hypogonadism, and premature menopause, chronic malnutrition and malabsorption syndromes, and chronic liver disease. Individuals can help prevent osteoporosis by leading a bone-healthy lifestyle at all stages of life. As I stated earlier, osteoporosis prevention begins in childhood with a bone-healthy diet rich in calcium and vitamin D, as well as plenty of exercise. This is important because the more bone mass one has when reaching adulthood, the less likely they are to have weak and breakable bones at an older age. Adults too can do many things to help maintain healthy bones and avoid premature bone loss, such as those things I just mentioned: having a healthy lifestyle, getting enough exercise, and simple changes in diet. Osteoporosis consists of 2 types: primary osteoporosis and secondary osteoporosis. Osteoporosis prevention depends on the type. Primary osteoporosis occurs in women after menopause, which typically happens around the age of 50. It also occurs in men later in life. Primary osteoporosis is not, however, merely a consequence of aging. It is also due to failing to develop that peak bone mass in early adulthood and having low vitamin D levels. Secondary osteoporosis occurs due to the use of medications or disease states that interfere with bone metabolism. Specific disease states include type 1 diabetes, celiac disease, and chronic liver disease, as well as medications such as anticonvulsants, thyroid replacement agents, and anti-estrogens. Men have a higher risk of developing secondary causes due to their higher use of corticosteroids and excessive alcohol intake. Osteoporosis is diagnosed by measuring bone mineral density. While traditional x-rays can identify spine fractures, they cannot measure bone density. It is measured by utilizing more specialized techniques such as dual energy X-ray absorptiometry or DEXA scans. They are the most commonly used for testing for osteoporosis. DEXA measures bone mineral density and predicts risk of fracture by monitoring bone density changes in patients with osteoporosis or those who are undergoing treatment. The density of the bone in the spine, hip, and wrist may be calculated, as well as the total body. The World Health Organization has defined a number of measurements for osteoporosis. The reference measurement is derived from bone density measurements in a population of healthy young adults. These are called T-scores. Osteoporosis is diagnosed when a person's bone mineral density is equal to or more than 2.5 standard deviations below this reference measurement. Healthcare professionals also use a calculator called the Fracture Risk Assessment Tool, or FRAX, to better determine a person's risk of hip, wrist, shoulder, and spine fractures after the age of 40. The calculator is available online and was developed by the World Health Organization. The FRAX tool takes into consideration a person's bone mineral density measurements and a number of other risk factors. It's an algorithm for estimating 10-year probability of fracture. There are also several blood tests that can be run to test for osteoporosis. Calcium levels in the blood, vitamin D, thyroid tests, parathyroid hormone, follicle stimulating hormone, testosterone, protein electrophoresis, and alkaline phosphatase. Osteoporosis can cause several complications. Severe pain is one of those complications, including persistent back and neck pain. Osteoporosis can also cause a loss of height, a stooped posture, or the development of a dowager's hump. Restricted mobility is also a big complication that it causes, and the loss of activity caused by osteoporosis can cause a person to gain weight, and this in turn increases the stress on hips and knee joints. For those at a higher risk, drug treatments are needed to help prevent bone fractures due to osteoporosis. The type of treatment prescribed depends on the patient's risk profile. This includes risk for specific types of fractures like hip or spine fractures, other medical conditions, or current medications. Finally, cost and cost effectiveness is also considered by the physician before prescribing any treatments. Like all medication, osteoporosis treatments will only work if they're taken properly. And as with any medication, there are side effects to these treatments, but for people with higher risks of fractures, the benefits of taking these treatments and using these medications usually outweighs any of the possible side effects that may occur. In addition to drug therapy, calcium and vitamin D supplements are often prescribed to ensure maximum effectiveness of these medications. The recommended dosing for calcium is 600 to 800 units daily, and for vitamin D, it is 1200 milligrams daily. To conclude, I think it's pretty evident that the main takeaway from this presentation is that prevention is key when it comes to osteoporosis. While it is possible for osteoporosis to be hereditary, it's also a very preventable disease in a lot of cases. Throughout the lifespan, osteoporosis is greatly affected by genetic factors, nutrition, physical activity, medications, endocrine status, and general health.